Hi, and welcome to the first episode of Get Informed. Today and in this video, I'm going to go over the general signs and symptoms of COVID-19. Now, the reason why we decided to include this topic as our first episode is because of this misunderstanding many people still have, thinking that an infection caused by SARS-CoV-2 virus or COVID-19 presents merely and only with respiratory signs and symptoms. But that's not all. And it has many more signs and symptoms that are actually being found every single day also. In fact, something interesting about this virus is that it also presents asymptomatically. And even though someone might be infected, he or she might be transmitting the disease to other people unknowingly. And that's why they say it's essential to follow the social distancing measures, to not go to the crowded places, and to wear masks. It really is the time to be smart to be safe. And according to CDC also, it takes 2 to 14 days after the initial exposure to the virus for these signs and symptoms to start presenting themselves. Now, what are these signs and symptoms? So some of them include chills and fever with an oral temperature of 37.5 degrees and above, muscle pain, headache, fatigue, cough and shortness of breath, difficulty breathing, and some gastrointestinal signs and symptoms such as nausea, vomiting, and diarrhea, and even onset loss of taste and smell. Now, these signs and symptoms actually are quite universal, meaning that other viral diseases and even allergies have the same signs and symptoms, and that's why it's so hard to distinguish between them. So it's recommended that if you're showing any of these signs and symptoms to self-isolate and monitor yourself. And if need be, contact your doctor or any health authority in your local area to see what are the standards of protocol or protocols to use. If you have any questions, you can always send us through the direct messaging system or just put a comment under this video. Otherwise, until next time, stay safe, stay happy. Thank you.